On to this now, a survey done by HIV activists from the Treatment Action Campaign indicates there's been a drop in the supply of antiretrovirals during the lockdown. This in turn increases the danger to those living with HIV as they now risk having being exposed to COVID-19 while fetching refills from health facilities. We're joined by the TAC's General Secretary Anele Yawa via Skype for more on this. Enkosi Bram, for your time. Now, the World Health Organization recommends that all people living with HIV have at least 30 days of ARVs with them, but ideally a 3 to 6 month supply. What are we seeing in South Africa?
Thanks, Swam, to you and the viewers at home. Firstly, since after the lockdown, TAC has conducted a rapid survey visually where we were looking at HIV and TB services as to say, where are we as the country? One of the things that we have noticed is that in many provinces, people living with HIV, TB, and other chronic illnesses are given 1 month supply, which others are given 2 month supply, which makes them to frequent the facilities. And the question we're asking ourselves, what do we say about social distancing if scientifically it has been proven that people with a weakened immune system are vulnerable to the infection of the COVID-19, which means people living with HIV, TB, and other chronic illnesses, when they continuously go to facilities on a monthly basis, we are exposing them to the infection of the COVID-19, but also we don't adhere to the rules of social distancing. It is against that reason where we are calling for people living with HIV, TB, and other chronic illnesses to be given 4 to 6 months supply so that people cannot continuously expose them to COVID-19, but also to the challenges of our healthcare system that we all know that is broken.
What does this speak to? This suggests that perhaps provincial health departments do not have capacity. Were you able to engage them and find out why this is so?
So at the present moment, we started conducting this survey from April, and on weekly basis we're getting updates because people are working visually. So one of the things that we're planning to do is to engage with other organizations of people living with HIV, like your NAPWA, your Positive Women's Network, your Sanarena, your Positive Action Campaign, because they have been doing a lot of work in other areas as well, so that we can have a consolidated report. Then from there, it's only then that we will engage with authorities like your Minister of Health, your President. We will reach out to them where we will come up with other suggestions, because it's not only the question of monthly refills. There are a lot of challenges, but in like for instance, before lockdown, other people were in other areas. Like for instance, Anele was in East London before the lockdown, and by the time the lockdown was announced, Anele was unable to move from East London to Utenik. And Anele does not have a permit in order for him to move from East London to Utenik in order for Anele to collect his medicines. When Anele goes to the nearest facility in East London, the first thing that Anele is asked is a referral letter. When Anele does not have this referral letter, it means Anele to be able to access medicine during that month. So there is a lot of issues that we have picked up through this survey, which we would like to table in front of the authorities and make some suggestions on how best can we improve as the country services that are related to HIV, TB, and other chronic illnesses.
The call from the TAC is not only for the rollout or for the refills to be capacitated, but also calling on national government to publicly encourage people who do not know or who haven't tested or who do not take their medication to do so.
Yes, so one of the things that we are picking up to our side is that our response as the country to COVID-19 is not integrated. We have a scourge of HIV and TB in the country. So now we've got an opportunity to reach out to our communities. When we reach out to our communities, one of the suggestions we're making, as much as we are screening, testing and tracing conducts of COVID-19, let's do so also on HIV and TB. We've got a lot of people who have defaulted on TB treatment. We've got a lot of people who don't know about their HIV and TB status. So why, when we go to our communities to screen and test for COVID-19, we don't test for HIV and also screen for TB? But also, one of the suggestions that we have made, we don't know whether it reached to the office of the president, was to say, President, you know that South Africa is having more than 7 million plus people living with HIV, and 4 million plus are on ARVs. But also, in the same breath, we've got a lot of people who are lost on follow-up. So we suggested that it will be a good opportunity for the president when he speaks to the nation. He encourages people living with HIV, TB, and other chronic illnesses who have defaulted on their treatment to be encouraged to go back to their facilities and access their treatment more, especially people living with HIV and TB. So this is one of the suggestions that we would like to send to the Minister of Health, to the President, to make sure that as much as we are responding to COVID-19, but we don't drop the ball on our country's response to HIV and TB.
Absolutely. Anele Yawa is the General Secretary of the Treatment Action Campaign. And